chromosomal genetic disorders. Objectives. 1. Describe disorders caused by abnormalities in autosomes. 2. Describe disorders caused by abnormalities in the number of sex chromosomes. 3. Summarize structural abnormalities of sex chromosomes that impact the use of assisted reproductive techniques. 1. Disorders caused by autosomal abnormalities. Disorders caused by autosomal abnormalities refer to genetic conditions that result from abnormalities in the autosomes, which are the non-sex chromosomes, chromosomes other than the X and Y chromosomes. These abnormalities can arise from genetic mutations, chromosomal aberrations, or structural rearrangements of the autosomes. Miscarriage and fetal demise are often associated with autosomal abnormalities that disrupt the normal developmental process. Genetic studies and chromosomal analysis have revealed that a significant proportion of pregnancy losses are due to autosomal abnormalities. These abnormalities can include aneuploidy, an abnormal number of chromosomes, or translocations, rearrangements of genetic material between chromosomes. In a study conducted by Edmonds in 1982, the presence of human chorionic gonadotropin, HCG, was monitored in early-stage pregnancies at 8 to 9 days post-fertilization. The study found that out of 112 pregnancies, 41% were maintained, while 59% resulted in miscarriage or fetal demise. This suggests that a substantial number of pregnancy losses can be attributed to autosomal abnormalities. Studies conducted in Vietnam have also reported a high prevalence of autosomal abnormalities in cases of fetal demise or miscarriage. Trisomies, which involve the presence of 3 copies of a particular autosome instead of the usual 2, have been associated with approximately 9% of spontaneous miscarriages. Examples include trisomy 13, Patau syndrome, trisomy 18, Edwards syndrome, and trisomy 21, Down syndrome. These trisomies can result in significant impairments in various organ systems, leading to abnormalities in facial features, heart function, intestinal development, nervous system development, and reproductive organ development. Having an extra copy of autosome 21, for instance, can lead to Down syndrome, which is characterized by intellectual disability, distinct facial features, heart defects, and other associated health issues. The severity and specific manifestations of autosomal abnormalities can vary depending on the affected chromosome and the genes involved. Overall, autosomal abnormalities play a significant role in miscarriages and fetal demise, highlighting the importance of genetic testing and prenatal screening to identify these abnormalities and provide appropriate genetic counseling and medical management for affected individuals and their families. 1.1. Down syndrome. Down syndrome is the most common chromosomal disorder associated with autosomal abnormalities in newborns. It is characterized by the presence of an extra copy of chromosome 21, resulting in a total of 47 chromosomes instead of the usual 46. The typical karyotypes observed in individuals with Down syndrome are 47 in XX, plus 21 in females and 47 in XY, plus 21 in males. The description of individuals with Down syndrome and their distinct physical characteristics was first documented by John Langdon Down in 1866. These characteristics include a round face, slanted eyes, epicanthic folds, extra skin folds covering the inner corner of the eyes, abnormal palm creases, and decreased muscle tone. The condition was later linked to the presence of an extra copy of chromosome 21 through the groundbreaking work of Lejeune and colleagues in 1959. Down syndrome is also referred to as trisomy 21 or trisomy G, and historically, it has been colloquially known as Mongolism due to some perceived facial similarities. The frequency of Down syndrome is approximately 1 in 800 live births, and it occurs across all ethnicities and social classes worldwide without significant differences. In about 95% of cases, individuals with Down syndrome have pure trisomy, where there is an extra copy of chromosome 21 in every cell, 47 in XX, plus 21 or 47 in XY, plus 21. Translocations, where a piece of chromosome 21 is attached to another chromosome, account for about 3 to 5% of cases, with the most common translocation involving chromosomes 14 and 21. Approximately 2 to 4% of individuals with Down syndrome exhibit mosaicism, where some cells have the typical trisomy 21 pattern while others have the normal chromosomal complement. Chromosome 21 contains around 400 genes, and alterations in the expression of these genes contribute to the characteristic features and health issues associated with Down syndrome. Some of the genes on chromosome 21 that have been implicated in the condition include SOD1, DSAM and DSAR, etc. Figure 8.1. Figure 8.1. Genes on chromosome 21 in human. https://i.imager.com/s2odp3a.png. Individuals with Down syndrome often experience a range of health issues, including congenital heart defects, gastrointestinal abnormalities, increased susceptibility to infections, and a higher risk of developing leukemia. However, the severity and specific manifestations can vary among individuals. The life expectancy of individuals with Down syndrome has significantly improved over the years due to advances in healthcare and supportive interventions. The risk of having a child with Down syndrome increases with maternal age. The frequency of having a child with trisomy 21 is approximately 1 in 2,000 for mothers aged 20 to 29, 1 in 1,200 for mothers aged 30 to 34, 1 in 300 for mothers aged 35 to 39, 1 in 100 for mothers aged 40 to 44, and 1 in 50 for mothers over 45. This is why the number of older women giving birth to children with Down syndrome is higher compared to younger women. The diagnosis of Down syndrome can be made through various methods depending on the stage of pregnancy and individual circumstances. Clinical diagnosis based on physical characteristics, prenatal screening tests such as ultrasound, double test, or triple test, cytogenetic analysis, karyotyping, and molecular genetic testing can all be utilized for diagnosing Down syndrome. The choice of tests depends on factors such as the gestational age, availability, and personal preferences of the parents. 1.2